Vitamin B12 is a necessary component for the synthesis of oxygen-carrying red blood cells in the human body. It is required for DNA synthesis and normal nervous system function. Vitamin B12 has many more purposes, ranging from supporting healthy skin and hair to enhancing memory and cognition. Vitamin B12, unlike many other nutrients that are generated in the body, must be obtained from the food you eat. This water-soluble vitamin occurs naturally in animal diets, making it challenging for vegetarians and vegans to get appropriate amounts. Milk and dairy products may still provide some vitamin B12 to vegetarians. However, the highest quality sources of vitamin B12 include liver and clams. Additionally, chicken, fish, and eggs are excellent sources of B12. Vegans may augment their B12 intake with vitamin B12 fortified meals or vitamin B12 dietary supplements. Despite consuming an acceptable amount of B12 in their diet, many people still may be deficient in this vital vitamin. This is due to the fact that several variables might inhibit vitamin B12 absorption, making it harder for the body to get the daily B12 requirements. But how do you know if you have a B12 deficiency? The symptoms of B12 deficiency are mostly caused by a shortage of healthy red blood cells, which are essential for oxygen transfer to all body cells. This deficiency in B12 may cause several physical and mental issues. Despite the fact that fatigue and weakness are the most typical symptoms, there are a number of subtle signs to be aware of. Here are our top 10. Number 10. Fatigue and weakness. Because a lack of vitamin B12 often results in feelings of exhaustion and lethargic behavior, it is sometimes referred to as the energy vitamin. When there is a deficiency in red blood cells, which are responsible for ensuring that enough oxygen is distributed throughout the body, it is typical for people to suffer feelings of weakness and exhaustion. Because this symptom is connected to so many other issues with one's health, many individuals are likely to disregard it. And moreover, they often avoid being tested for this deficiency. It's possible that this symptom on its own isn't enough to diagnose a B12 shortage. However, if you have been suffering indications of disorientation in addition to a lack of energy for many weeks, it may be time to make an appointment with a medical professional. Number 9. Nerve damage causing paresthesia. Damage to the nerves is both a long-term impact of not getting enough vitamin B12 and a more severe sign of not getting any of the vitamin. Myelin is a fatty material that surrounds the nerves and provides protection and insulation. The development of myelin is halted when there is insufficient vitamin B12 in the body. When myelin formation is impaired due to a lack of vitamin B12, a painful prickling sensation may be felt throughout the body. The term paresthesia refers to this unusual feeling that is felt by the sufferer. The nerves in the hands and feet, also known as the peripheral nerves, are the regions that are most often affected by this prickly feeling. This symptom may be caused by a wide variety of conditions, one of which is a lack of vitamin B12. Number 8. Mouth ulcers and glossitis. An inflamed tongue, commonly known as glossitis, is one of the oral symptoms of a B12 deficiency. This symptom may be rather painful. As a consequence, both the color and the form of the tongue will change as a result of this. The tongue appears smoother as a result of the buds on the surface of the tongue stretching out and disappearing. Deficiency in vitamin B12 often manifests itself with these early warning signs. Because glossitis causes discomfort and causes the tongue to become red and swollen, it is difficult to eat and talk when affected by this condition. Other oral symptoms such as mouth ulcers, prickly sensations on the tongue, or burning or stinging in the mouth may occasionally occur in conjunction with this. Number 7. Blurred vision. The clouding of one's eyesight is one of the indicators that one may be suffering from an inadequate supply of vitamin B12. In most cases, this condition develops as a result of a deficiency in vitamin B12, which then causes damage to the neurological system, which in turn causes a malfunction in the optic nerve. Because the optic nerve is connected to the eye, problems with it might result in vision loss. The damage may spread to the brain, resulting in a disease known as optic neuropathy. which is characterized by a disruption in the signal that travels from the eye to the brain. This ailment may be frightening, but it is mostly reversible and may be managed by taking vitamin B12 supplements. Number 6. Dizzy and breathless spells. When a person has anemia, caused by a lack of vitamin B12, it will be difficult for them to exert even the slightest amount of effort, and they may suffer shortness of breath and dizziness as a result of their effort. This occurs when there are not enough red blood cells in the body to meet the demand for oxygen produced by the cells, which occurs when the body is running short on red blood cells. Because of the non-specific nature of this symptom, you should see a medical professional in order to pinpoint the reason behind any odd breathlessness you may be experiencing. Number 5. Mood swings. People who suffer from this condition often report experiencing shifts in their mood. Low levels of vitamin B12 have also been related to depression, as well as dementia in certain cases. A molecule found in the brain called homocysteine may be degraded with the help of vitamin B12. There is a theory that suggests that elevated amounts of homocysteine, which is a typical amino acid found in the blood, might interfere with impulses traveling to and from the brain. It is also possible for this to result in a deficiency of neurotransmitters, which function similarly to chemical agents in that they change our mood and exert control over emotions. This, in the long run, will result in depression. However, it is of the utmost significance to be aware that mental health conditions such as depression and dementia may have a variety of different causes, which need evaluation and diagnosis by a medical professional. Some individuals who have a deficit in vitamin B12 may see an improvement in their mood if they consume more vitamin B12 in the form of food or take a supplement. This does not take the place of other alternative medical treatments that have been shown to be effective in treating mental health conditions, such as depression and dementia. Number 4. Cognitive impairment. It is also known to induce cognitive impairment or difficulties with thinking when vitamin B12 is lacking in the body. There is a possibility that you may struggle with thinking and have memory loss. It is possible the source of these symptoms is low amounts of oxygen that are reaching the brain. Studies have even gone on to correlate Alzheimer's disease, vascular dementia, and Parkinson's disease with low levels of vitamin B12. A very modest proportion of these instances of dementia have responded well to treatment with vitamin B12, which is not only low cost, but also risk-free. It is reasonable to declare that vitamin B12 cannot be considered a therapy option for each and every neurodegenerative illness, despite the fact that further study is needed to prove the existence of this relationship. Before making any rash judgments, it is in your best interest to consult a medical professional and get a professional opinion. Number 3. Irritability. Some people who were deficient in vitamin B12 exhibited overall irritation in addition to particular shifts in their mood. Although there is not enough research on the impact that vitamin B12 deficiency has on mental health, the theory about the role that vitamin B12 plays in breaking down the brain chemical homocysteine shows that high levels of homocysteine can lead to a shortage of neurotransmitters, which in turn control mood changes. However, there is not enough research on this topic. In the long run, this might result in irritation, as well as other mental problems. It is not right to identify a nutritional deficit based on just mood changes, such as irritation, since there might be a number of other factors at play. Number 2. Jaundice or pale skin. Vitamin B12 deficiency is often a slow-developing condition that manifests itself gradually before becoming more severe over time. Because of the characteristics of the symptoms, it is easy to ignore them or to assume that they are caused by something else. People who suffer from this deficiency often have pale skin, which is one of the signs that manifests itself. There is a possibility that their skin and the whites of their eyes have a very tiny yellow tint. Because of the function it plays in the production of red blood cells, nerves, and DNA, vitamin B12 is considered to be of the utmost significance to the human body. When there is not enough vitamin B12, the instructions for creating the cells are left unfinished, and the cells are unable to divide. This causes a kind of anemia known as megaloblastic anemia. in which the red blood cells continue to be large while being in a weakened state. Because of the substantial size of these red blood cells, they are unable to get from the bone marrow into the bloodstream, where they would then be able to take part in circulation. This is the cause of the decreased count of red blood cells as well as the resulting paleness of the skin. These frail and weak red blood cells are metabolized and eliminated by the liver at a faster rate than typical red blood cells. This causes there to be more beryllium in the blood than normal. The yellowing of the skin and eyes that are typical of jaundice is caused by the elevated levels of beryllium that are present in the circulation. Number 1. Coordination and balance problems. If this deficiency is not properly detected or treated, there is a possibility that major harm may be caused to the neurological system. This damage may also have an effect on how a person walks or moves. Because of the effect it can have on your equilibrium and coordination, you may become more prone to falling as a result of it. Because a lack of vitamin B12 is more frequent in adults over the age of 60, this symptom is notably more common in this age group. It is common knowledge that early detection and dependable therapy may make a substantial difference in the severity of the handicap caused by a deficiency. Even though it is not frequent, this symptom may also be noticed in younger patients if the deficit is severe and the condition is kept undetected for a considerable amount of time. Dietary sources often supply enough amounts of vitamin B12 for the vast majority of people. The treatment will be different for each patient depending on whether the deficit was brought on by an inadequate diet or if it has caused the person to have any neurological issues. Those who are not able to get enough from their food or have been diagnosed with a B12 deficiency may be instructed by a physician to take a supplement in the form of pills throughout the day in order to make up for the shortfall. People who adhere to a strict vegan diet may discover that it is difficult to get sufficient amounts of vitamin B12 from the usual diet and may discover that they need vitamin B12 supplements for the rest of their lives. Check your levels of B12 as soon as possible. Please watch these videos for more. Please like and subscribe, and thanks for watching.